So where were we? Here? No, here? Yes. Okay, in the second pair we were in the second pair. Let's continue. So I will repeat it again. So this is a normal situation when the blood is easily passing through the vessels and the gaseous exchange is happening. The gaseous exchange is taking place. In pneumonia, when there is some sort of infection caused by some sort of bacteria, which in pneumonia we have some sort of infection caused by some sort of bacteria, and when the infection happens, we have WBCs, that is white blood cells. White blood cells, what they do? They have antibodies. The antibodies fight the infection. What does the antibodies do? They fight with the infection. The proteins, there are proteins which help these white blood cells to fight the infection, and that's how we get our immunity. How we get our immunity? By the WBCs, which gonna help our produce antibodies, and these antibodies fight with the infection, and we get our immunity. So we have our immunity, we have our WBC, which is fighting with this infection. When they are fighting with this infection, so when the blood is flowing through this vessel, when the blood is flowing through this infection, then it is not going to flow easily. Some of the fluid is going to leak out. So the fluid is going to leak out into these spaces. These spaces are called interstitial spaces. These spaces are called interstitial spaces. Interstitial tissues. We also have some fluid oozing out. Oozing out means slowly coming out. But that what makes the interstitial fluid. But here the case is different. The case is that due to infection, the blood flowing. Due to infection, the blood is flowing, but the fluid is leaking out, which means it's leaking very fastly. It's leaking very fastly, and we have this area congested by. We have some congested area. The alveoli is going to get congested, and we are going to feel difficulty in breathing. We are going to have some difficulty in breathing. As we are having difficulty in breathing, when we go to a hospital, they are gonna do X-ray. What they are gonna do? They are gonna do our X-ray. So when the X-ray happens, then we will get this area congested by the fluid. The alveoli is congested by these fluids, and this congested area into the X-ray, it's called consolidations. This area is called consolidation. Based on the consolidated area, the pneumonia is classified. The classification of the pneumonia is based on the consolidation. Okay, here it is written consolidation. If it's in the lobes, these are the lobes. If it is in the lobes, it is called the lobular pneumonia. If it is in the lobe, it's called lobular pneumonia. If it's everywhere in the spaces, it's called interstitial pneumonia. It's called interstitial pneumonia. Okay, we have this lobular pneumonia and this interstitial pneumonia. If it is in the lobe, it's lobular pneumonia. If it is everywhere, it's called interstitial pneumonia. So, how we are gonna know that we have pneumonia? We will feel difficulty in breathing. The alveoli is congested. We're gonna feel very difficult. This is what we call dyspnea. Dyspnea means difficulty in breathing. We are gonna feel difficulty in breathing. Besides the difficulty in breathing, we are gonna cough with some sputum production. Okay? The cough with sputum. We are gonna cough a lot. When we cough, what will happen? There will be sputum, and we are going to produce sputum. So this is the symptoms. This is our disease. These are the symptoms. So what are the treatments? What are its treatment? So ask me. What are the treatments?
What are the treatments?
So treatments is we are going to take some antibiotics. The doctor are going to prescribe us with some antibiotics. The antibiotics are gonna kill those bacteria. The antibiotics is gonna help our immune system and kill those bacteria. It's gonna fight with those infections and help us resolve the fluid collection. If we take antibiotic, when we are gonna take antibiotics, it's gonna fight the infection and help us resolve the fluid collection. So the fluid collection is resolved and we are now normal. So this is the whole story of pneumonia. How the